Thank you. And thanks to everyone all across the world and the work that you're doing personally, for your families, professionally during this pandemic. Brene Brown talked about the pandemic in a way that was a global vulnerability moment. And I would suggest this is a unique time for us to look at what we value as a society, as a global community, and how we can improve and address many of the issues that are now becoming more and more visible that we need to consider as we think about digital public health. We're more globally connected than ever. We're more globally fragile than ever. I remind myself as I woke up this morning on the East Coast of the US, why I work so hard as I kissed my two daughters and my wife coming down for this presentation. And so I think in many ways we're reminded of how hard we work and how fortunate we are, many of us, like myself, to have the ability to work from home, for example. So what I wanted to talk about here is, in many ways, this global vulnerability moment, this visibility moment, especially as you think about the role of big data and digital public health. And I would also suggest the way in which each of us in our companies, in our organizations, in our settings, can reflect not only personally, but as within our families, within our communities, within our work communities, how we can maneuver and address this crisis. And once again, address these items that are becoming so much more visible. And many of these items are very data-driven. And data is such an essential component of being able to make good decisions. And so I wanted to briefly talk about how IBM, with 350,000 employees, over 170 countries, I mean, if there's a global community that I've been fortunate to be a part of nearly the past decade, it's IBM. And as we reflected and we reflect on how we responded to this crisis, we thought about our own employees first, the area of resiliency and adaptation. We do think that this new normal that is evolving will require a workforce that recognizes the need to adapt, to embrace digital capabilities and technologies. And whether it was from Wuhan to Wilmington, we acted as it relates to the safety and health of our own employees and our workforce. And so 95% of the IBM workforce now works from home, and 5%, many of whom are essential workers who support data centers that support our financial systems or broader health systems across the globe, are working in this crisis and really looking through evidence-based methods to really provide that health and safety that's so essential as you think about the social contract between an employer and an employee and the importance of trust. Which brings me to the area of trusted information and how essential it is at a time like this to lead with science, to leverage science and scientific experts and clinical experts and public health experts. And so leveraging AI in over 25 countries now, in terms of what we've gifted in terms of Watson Assistant to provide solutions that leverage evidence-based sources so that when people are looking at information about COVID, they're getting the most trusted and accurate information for their community. And we've done that through the Weather Channel, which has about 500 million users globally. And we've provided that access to that information about your cases in your community, but also to trusted sites and also links to the Red Cross, to clinical trials, to volunteerism, this recognition that health is very local and providing trusted information is essential, but also helping support people to act is also important and activate. And then accelerating discovery. We recognize that the supercomputers, the World Community Grid that we have also can support the acceleration of discovery. I think we all recognize that our capacity to learn, our capacity to maintain knowledge typically could be supported by computers that look for information look for that needle in the haystack, look for that mutation or that unique new study that you don't have the capacity to maintain in your own mind. So the use of supercomputers to accelerate discovery and research for doctors and scientists to address this COVID-19 pandemic, whether it's drugs that need to be repurposed or vaccines that need to be discovered, is another key component of our response. And so as we reflect and we continue to restlessly reinvent ourselves and think about the needs of the global community, our clients and our partners, we consider the importance of security. While we're talking about technology and digital, I would say the most essential ingredient in health and healthcare and public health is trust. It's fundamentally about the relationships and how technology is used to facilitate the trust that's so foundational and fundamental in those relationships. And so whether it's cybersecurity, whether it's business continuity, whether it's data that needs to be secure through the cloud or through a hybrid cloud, we all are now challenged with a new normal of, some roles. Can you work from home? Can you sell from home? Can you learn from home? And so in many ways, in the same way that my daughters have challenged me to share more of myself with their pictures behind me, I think there's a vulnerability moment for us where we're learning more and more about what can be done at home versus what could be done at a work site or a workplace. And so making sure when you go to that workplace, you're safe and you work smart is really essential as well. So another area that we've worked very hard on as a company, as we think about our role, and the recognition that all companies are health companies. I think the pandemic has recognized this, and all organizations are health organizations. And so I think many of us are familiar with the curves. It's extraordinary how IBM has been around about 110 years. The last global pandemic in 1918 was 102 years, but we all have gotten what I would call literacy in public health, the idea of these curves, whether it's cases, hospitalizations, deaths, and the need for us to work together across an ecosystem to help flatten the curve and bring things back to normal. And then this challenge of health and economy and privacy, the balancing act of this, what we call a trilemma across so many topics and issues. So this highlights, of course, as we recognize there's so many curves that need to be flattened in COVID-19 and in each community, in each country. But as we reflect more broadly, as we're looking at the big data, as we're talking to clients and partners, as we're thinking and recognizing the broader issues that exist in public health, we recognize there are 4 curves that need to be flattened. In addition to the infectious disease curve, which of course COVID-19 has helped us recognize, and you can't forget about things like the flu. But you've got now this challenge where mental illness is becoming much more prevalent, higher incidences as we're socially isolated, as we're more depressed and anxious. We're also seeing that many people are delaying care, their chronic disease care, their mammograms, their colonoscopies, their preventive services, their vaccinations, as you look at the big data. So the challenge then is, what is happening is these diseases are getting worse. You could have a cancer that could have been treatable become a metastatic breast cancer. You have, a heart disease situation that's more treatable that could become a major heart attack. So we've got challenges in the chronic disease curve. We've also got inequities. I think this global visibility moment is making us recognize how fragile we are as a society. How communities of color and poverty and indigenous populations are often the more significant victims, more vulnerable victims, the elderly of this virus. And it does challenge us in terms of what we value and what we must do to flatten the 4 curves of COVID. So as you reflect on the opportunity here, this slide, in my mind, represents really the essential on the right. it is ultimately in health and healthcare and public health about relationships. It's about those relationships and what role does technology play in supporting those relationships. And as you think about public health and digital public health, you need to move from the determinants of health, which we recognize are much more than just healthcare, what happens in an exam room. It's what happens in the community, hospital to home, clinic to community. You have to think about the social, the environmental, the behavioral aspects. Of course, you have to think about the genomics as well as the clinical care and the access to clinicians or community health workers, wherever you are. You have to think about the data that represents those determinants, and you have to consider how those need to be weighed based on the knowledge and the evidence we know. We know that social, environmental, and behavioral determinants of health represent 70% of health outcomes. So if our interest is in having healthier outcomes and living longer and healthier lives, then it is essential that we have the appropriate data sets that represents those determinants. And then providing access to that information, those insights, whether through analytics or artificial intelligence or machine learning, to the decision makers to give the right information at the right time to the right person in the right format so that it's something that actually is going to be embraced. And there's a time and a moment for a different intervention to be taken where the data isn't too late, the insights aren't too late. For stakeholders in health and healthcare and public health, governments, of course, life science companies, providers like hospitals and healthcare systems, community health workers, primary care providers, specialists, and then payers. And I want to include here in payers, employers. Employers and large multinationals like IBM have an extraordinary influence and opportunity by how they create a culture of health, how they create it for their employees, their families, and their communities. And they are often the largest purchaser or payer of health and healthcare. And so as a buyer of care, you could demand that the system delivers better. So as we think about determinants, data, and decisions, and I'm fortunate to be a part of the 3D Commission, which is a commission sponsored by the Rockefeller Foundation. This is so essential as we think about the age of COVID and beyond. So as you once again look at the applications and the ways in which you can leverage this technology, from what I like to say, from benchside to bedside to curbside, or for the more traditional microscopic views of the world to the clinical views of the world. As a primary care doctor, I trained in taking care of patients and learning about the microscopic aspects of the pathology of disease. And then the curbside, which in so many ways I've learned to appreciate post my medical education and training, the understanding that the communities in which people serve, there's so much. If you reflect on the 8,760 hours that we have in our year, and how many hours are typically spent in a clinical setting, it's the average person only has maybe two hours and maybe 30 minutes with a physician in most of our developed world countries. That's the dynamic that exists. And so much of health comes outside of those hospital walls, those exam walls, in the community, in what I call curbside. So how do we leverage technology in each of these areas? So digital public health, clearly you've got to think about the microscopic. We are in a race for a vaccine. We are in a race to find drugs that can be repurposed or developed, convalescent plasma for COVID-19 patients. We're in a race to look at ways to recruit people into clinical trials. So this is an extraordinary opportunity for us to leverage technology to support that effort. And this is one example of thousands of publications that we published at IBM Research, and it showed that we were able to find very early, and it's had 40,000 downloads, this article, working with our partners, publishing one of the mutations that are connected to potentially targets for vaccine development. And so this was one piece of evidence and science in that space. As you move from benchside to bedside and you think about the clinical opportunities, we're very proud of the work we've done supporting these key stakeholders, these key partners in the Middle East as it relates to especially the clinical workflows, the integration of health systems. If you think about the silos of data that I was referencing before, the need to bring different data sets together to leverage integration and intelligence so that you get the right insights to the right person. There are many examples that we have, and we're just very proud to partner with the Kingdom of Saudi Arabia, with Cleveland Clinic Abu Dhabi, the Dubai Health Authority, as just a few examples listed here in terms of how we've leveraged our technology pre-COVID and now during COVID, and we definitely believe it'll be essential post-COVID as we redefine this new normal. And as you think about the curbside, and once again, I reflect on that, on the communities, particularly the vulnerable communities across our globe, and as we, as you know, this society, this global community reflect on the populations we need to serve, I want to emphasize those populations that are most vulnerable across the globe. And so we've worked with, for example, NHS Scotland on benefits that go beyond healthcare, social, human services benefits, and the ways in which we can change the paradigm of how those services are delivered and how we can better automate, better simplify, make more efficient the delivery of those benefits to those vulnerable families. And this is, once again, another example of leveraging data, analytics, technology to support such an important need, especially as we reflect on those vulnerable populations in the age of COVID. So going from that leveraging of technology, and I want to emphasize being data-driven, being science-based is really essential. This is, the picture here is the headquarters of IBM Research. It's known as Yorktown Heights in New York, and this is the headquarters for IBM Research. We've invested in research as a company since our beginnings, and we are very proud of how we've been leading in patents for 27 years and how that commitment to science continues to be so foundational to the work that we do. You need evidence-based interventions, you need evidence-based bedside, curbside insights. You need to be transparent. That's a powerful part of science, that data, those insights are transparent to the broader scientific community to look at, to analyze those results, to recognize there could be biases in the data sets. There could be biases related to the authors in terms of how they present their evidence and how they may have conflicts of interest. So this commitment to science is, in my mind, so foundational to the values we have in the age of COVID and digital public health. So this is my last slide, and I think I just made a couple minutes before 20. So what do we value in health? So in the US, we have this reference we call value-based care, which I would suggest is unique, as I've had the good fortune of being a global public health professional and traveling across the globe, and now traveling quickly across the globe through mediums like this. It's extraordinary to think about how the values, the culture of health is different in different settings, in different countries, in different communities. But in the age of COVID, we have an opportunity to challenge ourselves. What are the values we have as we reinvent our health systems, and we think about our global community together across the G20 and beyond? So science, I think, is essential. I referenced, and I made a couple references to family there. I think it's so essential now that we recognize how globally connected we are and how we're often now more reminded than ever as we think about the vulnerable populations of COVID, the elderly. I think about my mother, who's definitely in a risk factor category, and taking care of her as well as my children and my wife. So this idea of family and how we can, in the age of COVID, address that more solidly, more effectively. Resiliency, if you think about the mental health curve and the challenges there, how do we promote mental health? How do we prevent disease, not just treat disease, so prevention? And then the issues of equity, and of course the issues of community. So on that note, I really appreciate the opportunity to connect, and I'll hand it back over to our chair, Mahmoud. Thank you.